Thank you for joining us today for our last coronavirus briefing of November. It's been a week since our last briefing, so Mayor Demings will be giving out the latest numbers for Orange County, as well as updates on several programs that involve CARES Act monies designed to help our citizens weather the pandemic. Orlando Mayor Buddy Dyer is here to talk about the city's expanded access at neighborhood centers and athletic fields, and also rental assistance to citizens. And Dr. Raul Pino will help break down all the numbers and look at what lies ahead now that we are through Thanksgiving. Mayor Demings.
Thank you, Jane. Thank you to all of you for being here this afternoon. If you're like me, you had a strange Thanksgiving holiday season or period. I had the opportunity to spend a little time just with my immediate family, those who live in my household and with my 98-year-old father. My siblings and I could not get together, and other extended family members, some of my children who are adults and grandchildren, we could not gather together. So that's why I say it was a little unusual. But we got through it, just like the rest of you and the rest of America is getting through it. So 2020 has been just one of those challenging years for us. This is our 90th coronavirus update that we have provided. So it's a milestone day for us. I want to point out that since it is November the 30th, this is also the last day of the 2020 hurricane season. And we've gotten through it. This was a record year. There were 30 named storms, but we were fortunate that none of them actually directly impacted us here within the Central Florida area. But we're still dealing with a pandemic, so I think that more than made up for the fact that we didn't have a hurricane this year. The longest period of time in our history that we have been under a continuous state of emergency since March, 263 days or so, I believe it is, that we have been under one continuous state of emergency. Each week that we start the week off, we try to share with you our goals for the week. We try to share with you good news and the bad news as we try to manage the virus here within our community. So I'm going to do that this week. I'm going to start with the goals for the week. Obviously, our goal is to continue to contain the spread of the COVID-19 virus within our community and keep our community overall a healthy community. We will continue to offer free COVID-19 rapid and PCR testing through the Orange County Health Services to anyone who needs it. I took advantage of the free testing that was being done at Barnett Park myself last week, and I insisted that most of my family members also go and get tested, and many of them did. So I encourage you, the residents of Orange County, if you desire to be tested for free, you can certainly go to Barnett Park, and you can still go to the Orange County Convention Center, to the state location as well. We will offer another chance for financial assistance to individuals and families. So in terms of good news, on December the 8th, we will open our portal again for individuals and families. We will likely provide up to $10 million in assistance to individuals and families who are residents of Orange County. More details will be provided at the next press conference regarding the COVID-19 virus here within Orange County on Friday of this week. With the Thanksgiving holidays now over, we want to remind our residents that they should continue to wear masks, wash their hands, and watch their social distancing. Right, Dr. Pino? Yes, sir. Many metropolitan areas around the country are experiencing a third wave or surge of the virus within their communities. Dr. Pino will talk with you about what we expect to happen here within the metro Orlando area, in particular here within Orange County. The State Department of Health recently released the updated numbers for the state, including Orange County. There are a reported 58,325 cases in Orange County. That is an increase of 517 cases from Saturday to Sunday. We now have 645 Orange County residents who have died as a result of the coronavirus. That's an increase of 16 from last Monday, 16 additional deaths since last Monday. While that may sound like a small number, there's still 16 families that were directly impacted, and so we certainly offer our prayers to those families who had to deal with that. I want to talk a little bit about the continuation of offering testing here within Orange County. At Barnett Park, Orange County Health Services will continue to offer testing for 7 days a week. That's every day between the hours of 9 a.m. to 5 p.m. We offer both rapid or antigen testing and the PCR or molecular testing. Every resident who gets tested there will also be provided with a free supply of PPE. The demand for testing was extremely high around the Thanksgiving holiday, and the site has seen its busiest week so far. A week ago today, Monday of last week, was our highest single testing day. There were 1,755 tests given on that day. Since last Wednesday, the county's COVID testing site at Barnett administered a total of 5,447 tests. Some of those days we had to close the car line early to allow everyone to be tested by the 5 p.m. closing time. Our best advice to those of you who go to that site is to arrive early, get in line early. For more information, go to ocfl.net/testing. Now let me talk more about the Orange Cares program that we instituted here within Orange County. We have paid out over $42 million in checks to individuals and families to date. This includes the $1,000 grants. That means we have assisted 42,000 Orange County residents whose income has been negatively impacted by the pandemic. Our team is still working to get us additional funds out by the December the 30th deadline that was established by the federal government. For those residents who have applied, you should hear back on your status within the next 2 to 3 weeks. Pay attention to our social media posts and our website. Much information is there, again, at ocfl.net/orangecares. Let me talk now about our eviction diversion program for landlords and tenants. We will continue to accept applications through December the 16th for individuals who want to avert being evicted from their homes. There's help for you. Nearly 2,000 Orange County families have been able to stay in their homes thanks to the CARES Act monies. $6.1 million have been paid out through the Comptroller's Office to landlords on their tenants' behalf through this program. Again, tenants can get up to $4,000 in assistance. Some of our CARES Act money has gone to Career Source of Central Florida through a partnership with Valencia College. We are offering short-term training courses. This is to provide upskill training for residents who may be underemployed or unemployed. The program is called Help is Here, and Orange County residents can apply for tuition assistance through Career Source Central Florida. That is a derivative of the CARES Act funding that we received here in Orange County. Individuals can receive up to $125 stipend to go through these short-term courses, and of course, we're paying for the training. It began today at the Orange County Convention Center. So far, 115 people have signed up for the courses, but there are over 70 spots left. So if you're interested, again, you can go to our website for information, or you can go to the Career Source of Central Florida website for more information. The programs still available are for certified production technicians, distribution operations technicians, electronic board assembly, masonry, and Microsoft Office specialists. These jobs that once you complete these courses, the hourly rate can be anywhere from $12 to $20 an hour. So in order to qualify, you must be at least 18 years old, a resident of Orange County, and able to verify that you lost your job or suffered reduced wages because of the COVID-19 pandemic. Again, for more information, you can visit careersourcecentralflorida.com/helps is here. Help is here. Help is here. Our PPE giveaway program for small businesses will begin tomorrow and will continue through Thursday of this week. Appointments are necessary. Small businesses must register in advance, and we have over 5,400 appointments that were made at 3 Orange County parks, Downey, Cypress Grove, and West Orange parks. Packets of face masks and hand sanitizer will be given to the small businesses who register. Many of you have asked questions about how active our strike teams have been. These are our compliance teams. They have now visited over 5,400 Orange County businesses, helping them comply with CDC guidelines. The overall compliance rate is extraordinary, 97%. Nearly 670 businesses have been re-inspected, and they have a compliance rate of about 81%. And 'tis the season, right? So we kicked off our Mayor's Toy Drive a week or so back. We are actually a month ago, I should say. We are a month into it, and last week we did some drive-through programs at various parks. So far, nearly 2,800 toys have been donated to support Orange County families in need during this holiday season. 80% of the toys online have been purchased. That means that 20% is still out there. And so we're depending on our Orange County residents to make it 100%. So you can do so by going to our website at ocfl.net/toy drive. There are 20 drop-off sites across the county if you want to drop off in person. We ask that you donate a new unwrapped gift through December the 14th. Mayor Dyer, you're up.
Thank you, Mayor Demings. I hope everybody had a safe Thanksgiving and practiced their pandemic precautions. It continues to be up to us, each one of us, to continue to control the spread of the virus, and as we enter this busy holiday season, we have to continue to do this as a community to protect each other, to protect our family's health and the health of our economy. So, speaking of the economy and helping out businesses during these times, I want to remind our small businesses within the downtown CRA that applications for the COVID-19 Small Business Rental Assistance Program closes this Friday, December 4th at 5 p.m. We expect to reopen the portal again, but I want to encourage businesses who are interested in applying to do so by December 4th. Applications and requirements can be found online at downtownorlando.com/SBRAP, which is Small Business Rental Assistance Program. And speaking of rental assistance, today I'm pleased to announce the reopening of the city's COVID-19 rental assistance program for families and individuals to get rental assistance for payments that were not made since March the 1st. The program, which is funded with COVID relief funds from the state, is administered in a partnership with Heart of Florida United Way, and it originally opened in September. To date, we've helped more than 220 families with nearly $700,000 in financial support to help them get current in their rent. The state recently made it easier for residents to apply. They have a streamlined, abbreviated application and has provided the city an additional $950,000. Residents interested should visit orlando.gov/assistance to complete the pre-screening process and determine eligibility. These funds are limited and must be dispersed by the end of the calendar year, so the pre-screening process will remain open until December 15th or until the funds are expended. We're grateful to have this program to help alleviate the pressure and stress on families to help them with their unpaid rental payments. As a city, we've continued to work on ways to provide amenities for our residents to safely exercise and do different activities during this pandemic. And earlier today, we announced that selected neighborhood centers will expand access to fitness facilities, select senior programs, gymnasiums, after-school programs, community rooms, athletic fields, and basketball courts. Many of these facilities and programs have been closed since March, and our residents have been asking us when they would reopen. So health and safety protocols have been put in place as part of this limited reopening, including reducing capacity, requiring facial coverings, temperature checks, sanitation stations will be available throughout all rooms, social distancing will be required, continuous cleaning of equipment and surfaces in rooms, and for rentals will require a COVID safety plan be submitted for review and approval before activities can take place. For more information on specific programs, reopening, and safety requirements, visit orlando.gov/COVID-19. And lastly, I'll remind everybody that tomorrow is Giving Tuesday. And our city is fortunate to have so many countless organizations that have been providing assistance to those in need during this pandemic. And tomorrow is a great opportunity to help support their efforts in this holiday season. And during this challenging time, if you're able to, I hope you'll join in making a donation to your favorite charity. Thank you, and thank you, Dr. Pino.
Thank you, Mayor. So before we get into the numbers, and I have a few numbers for you today, I would like to give you three areas that I would like you to think about. First, remember that we have several flu pods, 3 of them last month, during this month and the month before. So I want to tell you that we vaccinated 2,614 individuals in our community for free during those 3 events. And we would like to thank our partners, the Orange County Public Schools, the Orange County Sheriff Office, as well as the City of Orlando Police Department for their support. Also, tomorrow is World AIDS Day. Tomorrow is the day that we celebrate the life of those who have died and encourage those who have the disease to continue to live healthy lives. So it is an important celebration. And it's also important for our county because we have received, the health department at the county level from the state of Florida have received significant resources to fight the pandemic, the HIV pandemic that we have for the last 30 years. So more information on that will be coming available and what are the plans and what we are going to do. But we would like also for people to know that you can request online a test kit for HIV that you can do at home on your own privacy with all the information that comes with the test, how to reach us, what to expect, what to do next. And it is an important resource for those that for whatever reason, may not be able to get tested. And the website is talktestcfl, like centralflorida.com. And in there, you enter your information. It's completely private. It's not shared with anyone. And the health department will mail a test kit to you with information on how to conduct it and what to do depending on the results. Also, for COVID-19, these messages are really important right now. We are about to enter a critical phase in the pandemic. Stay home if you feel sick, wear your mask, wash your hands often, avoid crowd, close spaces, and close contact. Wash your distance. Clean and disinfect surfaces that often touch. And also, I will advise anyone who travel during the holiday outside the county or receive guests from outside the county or have visitors from outside the family circle at home for dinner to get tested in the next few days. And that's what I'm saying, what this period is very critical. We're about to receive a vaccine, maybe in a couple of weeks. So all that we have to do is a little bit more of a stretch to protect people who are in assisted living facilities. And I'm going to go into that reasoning. But it's important that even if you don't feel any symptoms, but you have traveled and been in contact with people from outside your intimate circle to get tested, our concern is asymptomatic people. It is about 25% of all cases in Orange County, and in some areas of the country it's up to 50%. And those are critical in the transmission of the disease, because if you don't feel sick, if you don't look sick, you will not protect yourself, others will not protect from you, and transmission would happen. Now, as you know, many areas of the country have experiencing a third wave, and the Mayor Deming, that is, talk a little bit about that. We are not there yet, but it depends on us how that goes. If we observe those prevention strategies that I talked to you before, we will be in good shape. And also, I will give you the data, but just a general assessment. Our hospital systems are performing very well. We don't have shortage of beds, or services in our hospital at this point. And I will show you that graph as well. So for today, we have 58,325 positive cases accumulative. It could be a little bit of difference between what the mayor is saying and what's said, because the cutoff was at different times. In the cases of death, I have one more than the mayor. A mayor, that happens after we give you that information. So with that, we received 17 additional deaths related to COVID-19 since November 23rd. Those were 1 Asian, 6 Black, 1 white, 9 white, and 1 other. For ethnicity, 6 Hispanics, 10 non-Hispanics, and 1 of unknown ethnicity. The age range was from 57 to 92, 9 female, 8 males. Now, 7 of those deaths occurred in August and September and were in the approval process at the state level. 2 occurred in October, and then 8 are from November. 8 are the most accurate of those. So if we can put the data up. So I would like to thank, the people that always prepare all this data for us here, and that will be Jim Pei and Cassandra Fonseca and many other people that are behind the scenes working on this daily. So here is our census. I was talking to you that our hospitals continue to perform very well, and we have a healthy census of beds. On the 28th, that's the last day that we have information. This information that is released weekly. The county has 13, my glasses are, okay. The total census of patients was 3,150, and the total available beds for screening was 1,363. Now, this is an interesting graph, because this is ICU versus COVID and non-COVID cases. And if you can see, we have seen a small decline in the use of ICU beds from the prior week at 26 beds in use. And then you also have the pediatrics, which are increased, and this is for Peds. Now, pediatrics also, people are not in ICU only for COVID-19, but This is a comparison between COVID-19 and non-COVID-19 cases in ICU. And you see that it has been an increase in non-COVID ICU. This is the total number of ventilators available in our county. It continued to be very stable at the same levels, but also has been in a small decrease here in the number of COVID-19 patients on beds, which is also a positive move. This is our hospital census for COVID-19 in ICU beds. And if you can see now over time, you can see the first wave that we experienced, the second wave that we experienced in the summer, and then a small increase here that we experienced in October, but generally speaking, has declined over time. Now, this is COVID-19 non-ICU. And here the picture is a little bit different with an inclination to an increase of the numbers. And this is total COVID hospitalized in our county. That includes regular hospital beds and ICU beds, and the numbers also have declined a little bit. We have seen this in the past, but I want to show you this graph that we did here for age and positivity rate. So we separated everyone in the last 14 days by age group based on the positivity, and then calculated for those by age the positivity rate. The information to take from here is that especially 15 to 24 is where we have the highest positivity rate. Now, that is not a secret. We have mentioned that before. But it's also interesting to see how it declines with age. And this may have to do with the fact, first, we have made a great effort to protect people in this age group, but also this age group is very socially active. And that's the group that we are calling to follow all CDC guidelines in the next 4 weeks so that we can contain the pandemic in our county. This is the number of cases per week. And the interesting part for me here is that we saw a decrease of the number of cases last week. And although our testing increased tremendously, we think that we have days last week that we have 8,000 tests in a day. We never have done that before. I think that the interest in the holidays, the concern for people that were about to travel, did the right thing and they got tested, which is a great thing. Now they should do the right thing again and get tested again so that we can really prevent the spread of the disease. And this is the graph that I want to get to, these last two graphs. These are assisted living facilities. We have done a lot of work in coordination with the State Health Department and also with these facilities to contain transmission in assisted living facilities because they are accounting for the highest number of fatalities in our county. And in orange, you have the employees who are positive, and in blue, you have the residents who has been positive. And as you can see, we have a significant decrease in both categories, and we should make every single effort to keep it that way. And this is COVID-19 percentage among residents of long-term care facilities in our county. And it cannot be clearly that there has been a significant improvement for all the population who are higher risk and are the ones that we want to protect in the coming weeks. I know there are a lot of questions with regard to the vaccines. We don't have more information than you do, but this is what we know. It's going to be administered in different phases. We could receive the first shipment in the second half of December, maybe even the 12th of December. The phases are going to be handled in different ways, and we are waiting for the meeting that the CDC is going to have this week. But more likely, healthcare workers will go first, and probably within healthcare workers, risk will be assessed depending on who is in contact with positive patients. This is done this way because these are the individuals that are taking care of everyone, so they should be protected first. And then we probably will move into assisted living facilities for residents and staff because the high mortality rate that we have in those areas. Probably after that, it will come first responders. And then probably after that will be the schools. And then we will open to the general population. The general population could be vaccinated in different ways. The state health department at this point are planning include a fixed site where we will conduct 12-hour shift probably, or 8-hour shift, 3 shift, and to try to increase the number of vaccinated. And we also are planning to do drive-through vaccinations as we has always done in these cases. With that, I'm willing to answer any questions that you may have. Mayor?
All right, thank you, Dr. Pino. Just as a reminder to any of our Spanish-speaking media, we do have Spanish-speaking translators here. We are joined today by Commissioner Mara Uribe and Commissioner Gomez Cordero. They're both fluent, and then we have Ms. Ilia Torres, and then, of course, Dr. Pino is fluent as well. And so with that, we will open it up for any questions that you may have. Okay, we're in the front.
Steve Goudet from the Sentinel. I'm sorry. Numbers
You know, that's an interesting question because no matter how many tests we did, the positivity rate kind of was hovering at the same level, 7, 8, 6, 9. So that's a good thing. That's an indication that those may be the real positivity rate for our county, because independently of the number of tests that we conduct, we are always getting the same results. So that's a good thing. And that's what we want to keep. Even if we can bring it low a little bit more, it would be great. Remember, the positivity rate is a relationship, it's a correlation between the number of tests that you perform and the number of tests that you receive with positive results. And that correlation has been the same independently of the number of tests that we perform. So that's a good thing. That's a good observation.
And that figure is a manageable figure for us. It's not 5%, but it's close.
Well, that's a different story because 5% of 8,000 tests is more than 5% of 6,000 tests. So yesterday we got 500 positive cases, more than 500, 514, I believe. So that's a big number. If we continue to have those numbers every day for the coming week, then we will surpass last week in 3 days, 4 days. So that's why I'm making an urgent plea to everyone to follow CDC guidelines, because I think we are in a critical phase where this could take off if we don't extreme our measures to protect ourselves and protect others.
Hi, Dr. Pino. Come on back. Thanks. Hi, I'm Valerie, Fox 35. I had 2 questions. Number 1, are there any nursing homes on lockdown after Thanksgiving holiday? And number 2, what do you say to those who are afraid to take the vaccine, not sure how it will affect them?
So the lockdowns, now that I'm aware, we have any in lockdowns. We actually were concerned 3 weeks ago with some facilities. We have mentioned we have a large outbreak in a facility in downtown, and we work very aggressively with them, and he has been contained. So at this point, we don't have any burning fires that I'm aware in any long-term care facility. We have cases here and there, but nothing abnormal. With regard to the vaccine, I know there has been a lot of politicization of the issue from both sides of the aisle, and that carries a lot of mistrust depending on where you see it and the foresight, and in this side of the aisle politically. But I can assure you that the data that the CDC is going to review, the data that the FDA is going to review, and the independent bodies that reviews those data is going to be critical for the trust in the vaccine. And with the effective rate that they are providing by Moderna and Pfizer, it seems like those are very, very good vaccines. We will wait for the data. Some is going to be reviewed tomorrow. Some will be reviewed next week. But I will trust the vaccine. I will trust the vaccine.
All right, we're to the questions.
Yeah.
This is from Jennifer Marcial from El Sentinel. This weekend, we got video from a huge party at a nightclub in Orlando. Many people have reached out saying that there are many other bars and clubs with this same practice. People are concerned because there is no social distancing and definitely no wearing of the mask. What is the county and the city of Orlando going to do to avoid these scenarios? Can they do anything to intervene with these places?
We're going to continue to send our compliance teams out to monitor businesses. More than likely, before the end of this week, I will move forward with a decision about enacting penalties for businesses who are found to be in violation. Mayor?
I don't have much more to add than that. The governor took a lot of our enforcement capability away. We still do have the ability to enact some penalties directly on businesses, but one of the things that I've had people say to me is that we're pleased in Orange County that you guys have continued to encourage us to do the responsible thing rather than having to make us do the responsible thing or enacting different penalties or restrictions like they've done in California and some other places. So again, I would plead with the bar owners and other restaurant owners and the patrons of those facilities to be patriots and to think about your responsibility to protect others. So you may think you're invulnerable and can do these things, but if you're asymptomatic and you've been out doing this and come home and your grandmother happens to live with you or your parents live with you, you can expose them and you're endangering their lives.
I have directed the county attorney to draft an executive order that will likely give me the authority to institute some form of penalties. This would apply to businesses that are habitual violators of the guidance that really have been put in place at this time. So, for weeks now, I've come in, I've asked for voluntary compliance, and if we have a few bad actors, that's who we'll be targeting. It won't be the businesses who are cooperating and who are compliant. It'll be the bad actors.
This is from Pete Reinwald, a digital journalist with Spectrum News 13. Question for Mayor Demings. How much of an effect do you think the county's eviction diversion program is having on the lower number of evictions in recent weeks? Thank you.
I think it has certainly had a positive impact on reducing the number of evictions that would have been processed through the courts had it not been for the dollars that we are providing. We have been working with the Legal Aid Society and others in this endeavor now for several months. And I'm going to look to my Chief of Staff, Roseanne. I know you know the numbers in terms of eviction diversion. If you just come forward and share the total number at this point that where we have averted evictions, and it'll give you an indication of just how many people are still in their homes that would have likely not been in their homes as a result.
Thank you, Mayor. So we've allocated about $6.1 million so far to over 2,000 families, but we have a lot in the pipeline. And just since last Tuesday, we've had 186 landlords apply, and we've had about 170 tenants apply. So I think people are getting a little bit closer. Just do want to remind them, December 15th, we have to cut off the application process because we have to spend all the money by December 30th. But we feel like we've helped a lot of families, and 64% of these families are minorities, and the average size of the household is about 3 people, and it's diverse all over Orange County. So we encourage more people to apply. We feel like just with the backlog that we have, because it does take a long time to match the landlord and the tenant, that we will probably spend about $13 million by December 30th. And we've spent 6.1 right now.
So again, when I started out earlier, we talked about the fact that there was nearly 2,000 households. You think about that. 2,000 people that potentially would have been homeless, 2,000 households that because of this program, they have been able to remain in their homes.
This next question is from David Harris with the Orlando Sentinel. My question is for Mayor Dyer and Dr. Pino. There was a story picked up by TMZ about a concert at Gilt nightclub on Thanksgiving night where pictures on social media showed people packed inside the club without masks. Is this something strike teams are looking into or investigating? And what is your advice to small concert venues?
I think it's largely the same answer that Mayor Demings and I just gave in the last question, but I'll let Dr. Pino talk about the health risk and what pandemic precautions we should be taking.
Yeah, all the places should follow the same guidelines, and especially in closed doors, small space, crowded. We receive video from that place through emails that the population send us, and we have forwarded those videos to the right authorities to do what needs to be done.
Final question from Ryan Lynch from the Orlando Business Journal. For Mayor Dyer, how many households is the city looking to help with the remaining rental assistance funds?
So we did 200 and some odd. I'm not sure. It depends on whether they use the maximum amount. So the maximum amount is $2,500 per month for up to 6 months. So that'd be $12,500 per household. So that's from March 1st coming all the way forward. And you can look on the website and see what the criteria are for that.
All right, Commissioners Gomez-Cordero, Commissioner Uribe, you all have anything? No, they said no. All right, thank you all for joining us today. We'll talk to you at the end of the week.